Hello and welcome to the UW Health School of Diagnostic Medical Sonography informational presentation for prospective interviewees. Welcome all of our 2022 applicants. We are very excited to begin the interview process with you all. When you arrive at our facility, please take the elevators up to the 4th floor to Suite 440, where our program assistant Mark will greet you. And after your interview, we have a few of our students pictured here that will show you around our facility the day of your interview. Since we are still required to wear our masks, we thought it would be a good idea to introduce ourselves and give you a little picture of what we actually look like. So this is our program director, Michelle Cordio. She is a graduate of this program from 1997. This is Jamie Parkins. She is the Clinical Education Coordinator for the General Vascular students. She is a graduate of this program from the class of 2013. This is me. My name is Lindsay Thomas. I am the one narrating this whole presentation. I am the Clinical Education Coordinator for the Echovascular students, and I am also a graduate of this program from the class of 2013. Jamie and I were both classmates. This is Mindy Vanderleest. She is one of our instructors for the general vascular students. She is a graduate of this program as well from the class of 2012. This is Steve Williams. He is another instructor on our faculty. He teaches the echovascular courses. He is also a graduate from the class of 2015 from this program. Lastly, we do have Haley Krall as our PRN instructor for the general vascular students. I was unable to get a picture from her, but you'll be seeing more of her if you were accepted into the program. She is also a graduate of this program from the class of 2017. So sensing a theme here, all of our faculty are from this program. A lot of questions we get asked from students is where they are going for their schooling. So we are located here in this building. You will have all of your classes and scan labs here. You are onboarded through UW and UW-Madison, specifically for Canvas access, but you will still pay tuition and earn your degree through your designated college. As far as our clinical sites, they are located anywhere within 2 hours of Madison, so please plan on reliable vehicle transportation. We now are a 22-month program, so there are 5 semesters that you will attend: fall, spring, summer of your junior year, and then fall and spring of your senior year. And then graduation is at the end of May. All students learn vascular ultrasound. However, if you are accepted into the program, you will choose either general sonography or echocardiography. Here are the differences between those choices. So again, everyone learns vascular ultrasound. However, the general students will learn abdomen, OBGYN, intro to fetal echo, intro to MSK or musculoskeletal ultrasound, an introduction to pediatric sonography. And the echovascular students will learn adult and pediatric echocardiography. And here's a fun little picture pre-COVID of our seniors and juniors having a fun time at orientation, getting all their schedules together. Our overall goal is to educate students in the art and science of diagnostic medical sonography. Our graduates serve all of Wisconsin and honestly all of the country. There are several of our graduates who are across all states. Our missions complements the missions of UW Health, the UW Center for Health Sciences, and the UW Hospital and Clinics. I won't go too much into it, but if you would like, you can read the rest of our mission. So why should you choose our program? We are a long-standing program. We were established in 1980. We are KHEP accredited. We are a bachelor degree program. Other advantages of our program are that our graduates are able to pass their ARDMS board exams prior to graduation. I'll talk about board exams in a little bit. Several students have internship opportunities prior to graduation. We have 100% job placement prior to graduation. Our echovascular students are able to experience pediatric echocardiography at both the American Family Children's Hospital and the Children's Hospital of Wisconsin in Milwaukee or Neenah locations. We have guest lectures on both the general and echo side from renowned physicians from SSM, UW, and Meriter. And our students, by the time they graduate, will have over 1,600 hours of clinical experience. And we do fun activities like you see in the upper right-hand corner of Play-Doh activity from our Vascular 2 course. Here are the characteristics of a sonographer, as well as the characteristics we expect from the students that we accept: professionalism, detail-oriented, critical thinking, passion, knowledge of sonography, communication skills, confident but humble, compassionate, empathetic, problem-solving skills, technologically advanced, physics knowledge, hunger to learn, emotionally intelligent, independent but also works well in a team with collaboration, and community. So a little bit more about our program. This program requires a full-time commitment from you. We do have classes and clinical scheduled 40 hours per week. So the extra time scheduled outside of those 40 hours is required for homework, studying, family and friends, your physical and mental health, and a part-time job if you choose to do so. Again, the bottom right-hand corner is students working in our scan lab pre-COVID. These are both senior and juniors, so they're doing some demonstrations together. We also require that you do preliminary competencies here at the school in our scan lab with faculty to make sure that you are proficient in all of the exams that you are scanning prior to going to clinical. After you complete these preliminary competencies, then you will start to submit your clinical competencies with a registered sonographer. And you do have the ability to come to the school and scan extra for practice if you need some, or if you want to be a model for someone else. Going into our board exams a little bit, the ARDMS, what I had mentioned before, is the American Registry of Diagnostic Medical Sonography. That is a national certification organization where the students sit prior to graduation for their specialty board exams. So everyone requires physics and vascular. So that would be physics and RVT. However, whichever track you take, you will either sit for the RDMS board or the RDCS board. Here is an example of that board exam timeline. So your junior year, you will all take physics, or the SPI is the other name for it. Senior year, echo students will take adult echocardiography. General students will take the OBGYN board. Spring semester, echo students will take pediatric echo. General students will take abdomen. And then at the end of spring, all students will sit for the vascular board. As you can see here, our program outcomes are very successful. We have a high ARDMS registry pass rate at 100% for the class of 2021 and the 3-year average, 100% placement for jobs for both cardiac and general for both the class of 2021 and the 3-year average, and we also do have a high retention rate. As far as student expenses during your 22 months, you are required to wear navy blue scrubs, purchase your own textbooks, pay for memberships to professional societies and our South Central Wisconsin Ultrasound Society, transportation and gas, your own living expenses, some clinical ID badges, My Clinical Exchange, which is an annual fee, and of course your board exams. Although our students come from many different schools, there is a community that we love to be a part of in building. Our junior students are paired with a senior student mentor for guidance and advice, and all accepted students are sent a roommate request form to contact other students for living arrangements. Here are a few activities that we have done in the time of COVID as we are making the most of trying to bring our community together, even though we are limited by space and being close together and wearing our masks. Our students definitely make the most of it. They do have a lot of fun outside of what we expect of them at clinical and in class. On the left-hand side is our holiday party from last year, and on the right-hand side is our Halloween party from last year. This is the junior class. They actually had a whole theme of Shrek. It was very entertaining. Here are some more pictures of our senior class. So on the left-hand side is a gel bottle, in the middle is cardiac arrest, and on the far right-hand side is a cyst and a stone via ultrasound. We also do a pig heart dissection lab. We also have opportunities to help train fellows in MSK. So that's one of our students being scanned by a fellow with a sonographer assisting. And we always try to use our machines and scanning to make learning fun. We try to go outside even in this Wisconsin weather. We like to get you up and moving, get that blood flow to the brain. And we also try to make physics fun as much as we can. This is our physics review from last summer before they took their board. And of course, we always have candy. So what to expect post-interview, you will receive an email indicating your acceptance, alternate, or denial by March 18th of this year. Each year there are more applicants than we can accept into the program. This year is an astounding amount of students. The limiting factor is clinical placement, equal clinical education for all students. Make sure your email and address are current and you check your email often. If you are accepted, you must sign a document accepting your offer, submit a $100 non-refundable place holding fee, send us your spring semester transcripts, and follow up with Michelle or Mark. So I hope that was informational. Hopefully you can come up with some more interesting questions during your interview. Please check us out if you haven't already on the UW Health School of Diagnostic Medical Sonography Facebook page, Instagram, and of course our website. Here is our contact information. We will also have contact cards that you are welcome to take with you after your interview. Here are some additional resources to consider reviewing. And here are our students from this year. So we have the class of 2022 that will graduate this year in May on the top, and on the bottom, our class of 2023. So these will be the seniors when you come to our program. Thank you very much for your time, and we look forward to meeting you all on your scheduled interview day.